My name is Christina Lampe. I'm a surgeon and working at a metabolic unit at the University Medical Center in Mainz since 5 years. And I would like to show you a very rare metabolic diseases with a lot of overlap to surgical departments. So the first question is, why should a surgeon be aware of a rare metabolic disease like MPS II or a Hunter syndrome? And the answer is because surgeons play an important role in early diagnosis of these diseases. The surgical issues as a diagnostic clues is the hernia repair and ENT intervention or recurrent ENT interventions in very young children, or a carpal tunnel syndrome in childhood, which is very rare in normal population, and additionally contractures of joints. What rare metabolic diseases are we talking about at the moment? I'm talking about the Hunter syndrome. It's an MPS II, or called MPS II as well, a rare inborn metabolic, very heterogeneous and progressive multisystemic disease, which is caused by an enzyme deficiency that leads to an accumulation of storage material. Just to show you the multisystemic disease, so every organ system is involved in this patient. And the disease is very heterogeneous, so from very severe affected patients to very mild affected patients with only contractures of joints. For this reason, for this multisystemic disease, you need a multidisciplinary team, and the surgeon is playing a most important role in this team because the first signs and symptoms are hernia repair and ENT interventions. This is very typical in normal population as well, but the first sign of a Hunter syndrome, or could be a first sign of a Hunter syndrome. So ENT interventions are present in more than 50% of all Hunter patients, as well as hernia repair and carpal tunnel syndrome in 18% of all patients. Here you see the first interventions and the age of these first procedures, and you see the hernia repair and ENT interventions are at a median age of 3 years. So surgeons might be the first specialty that are in contact with these patients, except the pediatricians. So to summarize it, Hunter syndrome, be aware, it's a multisystemic disease which needs a multidisciplinary team to treat. Surgeons might be the first specialty in contact with these patients, and surgical intervention is often required at a young age, like hernia repair and recurrent or bilateral hernia repair, ENT procedures like T-tubes or adenoidectomy, tonsillectomy, or carpal tunnel release in children. So what to do with the suspicion of a Hunter syndrome in one of your patients because of hernia repair, ENT intervention, or carpal tunnel syndrome? The answer is send the patient to a specialized center for metabolic diseases to confirm diagnosis.